Dr. Stan Yates. I'm an OB GYN physician with over 30 years of work in women's health. Most women of reproductive age are naturally designed for a precise hormonal response every single month. This design is the key to unlocking your fertility potential. If you're planning to conceive now or in the future, this knowledge should be useful. A woman's menstrual cycle normally lasts anywhere from 21 to 35 days. Now, different health conditions may change the menstrual cycle regularity. Also, factors like stress, sleep deprivation, and even the weather can influence the menstrual cycle's rhythm. In creation, the number 4 suggests stability. We have 4 directions like north, east, south, and west. There are 4 elements: earth, air, fire, and water. In the same way, women have reproductive stability when 4 hormones work perfectly together. So let's take a closer look at these 4 key players that control your menstrual cycle. The hormones that work together in harmony to create the perfect environment for reproduction. The follicle stimulating hormone stimulates the ovary for growth and development of the follicle. Peak FSH occurs about day number 6 of the cycle. Most of the time, a single follicle reaches maturity and is ready to release the egg. Luteinizing hormone triggers the release of the egg from the follicle. That means ovulation has occurred. This hormone is most commonly measured with ovulation predictor kit. Both LH and FSH are called gonadotropins because they stimulate the gonad, which in the woman's body are the ovaries. As follicles mature, estrogen levels rise in the woman's body. Estrogen builds up the endometrial lining. At the beginning of the menstrual cycle, progesterone levels are low. Once ovulation occurs, the progesterone levels begin to rise, which also prepares the uterus and the endometrial lining for possible implantation for pregnancy. Now, there's a fine line between too much and too little of each hormone. While FSH is essential for follicle growth, too much of it can lead to ovulation disruption. Similarly, if LH levels drop too soon, it can prevent fertilization. If progesterone levels are too low, implantation may not occur. Let's consider each phase of your menstrual cycle. The menstrual phase is a phase commonly known as a woman's period. The uterus sheds the endometrial lining, which includes glandular endometrial cells and blood. The beginning of bleeding is considered day number 1 of the menstrual cycle. After the uterus sheds the lining, the ovaries are prepared to start the follicular cycle. The follicular phase begins as bleeding stops and lasts until ovulation. So for a 28-day cycle, the follicular phase lasts on average to day number 14. Estrogen levels begin to rise as the ovary produces maturing follicles. Many follicles may come close to complete maturity, but usually only one will become the dominant follicle. Cervical mucus production increases. This design of creation is efficient so that a single egg is available for a single baby, which is usually conceived. Be aware that the follicular phase can vary significantly from one cycle to the next. Also, some women have a longer follicular phase than others. These variations may not be a problem and are often influenced by hormonal differences, genetics, and even environmental factors. Ovulation is the 12 to 24-hour window where the surge of LH triggers the release of an egg. The normal process prepares everything for potential pregnancy. This time is considered peak fertility. The luteal phase lasts about 14 days. Progesterone levels increase. There is a part of the ovarian follicle that still has a role to play after the egg is released. The corpus luteum begins to produce more progesterone, which prepares the uterus for possible implantation after successful conception. If conception occurred, progesterone levels will continue to increase to maintain the endometrial lining and support the early stage of pregnancy. When the placenta starts to develop in the 2nd and 3rd trimester, the placenta takes over this role of progesterone production. The research suggests that a diet rich of antioxidants, vitamins, and minerals can enhance fertility during this critical phase. Consider a diet that includes plenty of berries, green leafy vegetables, and fatty fish to support your reproductive health. Now, be aware of your body's signals when you desire pregnancy. I recommend tracking your basal body temperature. The rise of a 0.5 degree to 1 degree Fahrenheit after ovulation can be predicted after several months. Watch for these changes in your cervical mucus too. It becomes clear and stretchy like egg whites during your fertile days. There are some optimal lifestyle factors which are healthy choices to contribute to your fertility goals. For exercise, aim for 120 minutes of moderate exercise each week. Your diet plays a crucial role too. Look for foods with omega-3 rich fish, leafy greens, and whole grains. Stress management is important. A routine of regular prayer, meditation, relaxation techniques is beneficial. As far as sleep goes, strive for about 8 hours per night to contribute to improved fertility. To recap, your menstrual cycle consists of 4 phases. You don't need to memorize the science. Your goal is to recognize your fertile window, which is possible through the delicate balance of your hormone. And the good news is, your fertile window is relatively easy to figure out. By tracking your basal body temperature, cervical mucus, and use of ovulation predictor kits, you can identify a trend with recognition of your likely fertile days. Then you can significantly improve your chances of getting pregnant. A common misconception is that the fertile window is just 1 day. In reality, the window is an opportunity of much wider dimension. Sperm can survive up to 5 days in favorable conditions, while the egg is viable for 24 hours after ovulation. So if you're trying to conceive, don't limit yourself to just 1 day. There is a 5 to 6 day opportunity to get pregnant. If you're planning on pregnancy, schedule a preconception checkup with your women's healthcare provider. Our goal at Stork Advisor is to encourage couples in their pregnancy journey. Don't forget to hit that subscribe button and join our Stork Advisor community for more information and tips on reproductive health. Well, this is Dr. Stan. Thank you for watching.